In the battle against coronavirus, this is the body armour. But shortages mean medics are being asked to reuse some of their disposable protective gear. Public Health England is even recommending plastic aprons if gowns are unavailable. One NHS worker at an intensive care unit in London told us of his concerns as stocks run out. He wanted to remain anonymous.
You can't say to people for this amount of time, these gowns are disposable, and then the next day say, oh, actually, we've changed our mind. That's the difficulty. If they had said from the very beginning, we can safely reuse equipment, then it wouldn't be a problem. The problem is that it is constantly changing, because it is very much reliant on the stock, not the evidence.
As well as suspicion, there's anger at perceived failings in the supply chain and its impact on the NHS frontline.
Staff will have to make difficult decisions, awful decisions about whether they are able to continue caring. The new advice gives us, if you like, bronze level adequacy, and second best in this situation is just not good enough.
Ministers and officials accept it's a challenge, but they're facing criticism. More isn't being done to source equipment from local suppliers. Why is there such a national shortage? Is it a failure to stockpile in the first place? Is it a failure of the supply chain to buy and distribute efficiently?
The government does stockpile PPE for pandemics, and that has been incredibly important and useful in our response to this. But as you hinted at, this is a global crisis, a global emergency, and there is undoubtedly a strain on supply chains for PPE.
The demand for certain items of personal protective equipment has increased 5,000% since the pandemic started. This week, a plane load of supplies arrived in the UK from Shanghai. The gravest shortage is in clinical gowns, and China is the only immediate bulk source. But there's massive global competition for protective gear, and it's causing delays with orders. Once stock arrives in the UK, it must pass a safety test, something that's not always guaranteed.
They were ordered a month ago. The consignments are coming in fits and starts, and sometimes when they are arriving, they are either not what was ordered, i.e. they're masks instead of gowns, for example, or they aren't passing the stringent quality tests that are required in this country.
China isn't the only answer. Turkey too has airlifted supplies and will deliver more tomorrow, including 400,000 gowns. It's the equivalent of what the NHS goes through in 2 to 3 days. Just-in-time PPE, not a long-term solution. Deborah Haynes, Sky News.